right? I mean, if they could just promote healthier eating, and there's no discussion on the preventative side. And we know that 92% of Americans are metabolically dysfunctional. And yet we are pushing big food, all this stuff. And it begins with our children. Our children are coming into the state of just high inflammatory. I mean, God, when I grew up, we never really had kids that were overweight, right? And the amount of autism, I think, I gave a talk and I looked at the statistics. It was when I graduated high school, which was in 1994, it was 1 in 1,000. It is 1 in 36, which I would argue that is wrong because in every classroom, there's at least 2, if not more. So the 1 to 36 ratio, I think, is actually inaccurate based on what I'm seeing.
If you're overwhelmed with chronic health symptoms and still don't have answers, you're not alone. I'm Dr. Jaban, and on Redefining Wellness with Dr. Jaban, we'll be exploring root causes like Lyme disease, mold, and parasites, and I'll guide you with simple and practical steps towards real healing. So today I'm here with Harriet Hansell, MD. She's an expert in peptides. And right now peptides are huge. There's a lot of talk about which ones can be used, can't be used, how to use them, and honestly what's working. So I wanted to have a conversation with you just to see, because you see them every day.
Yep.
What is working for, let's just start with energy production. People that have either mitochondrial issues, fatigue, CFS.
So it depends on what you're treating. I mean, I think back to gut health, and the cornerstone of a lot of people, they have a lot of gut inflammation. They're not absorbing nutrients as well. And so lots of times just using plain oral BPC-157 actually can help with leaky gut. I also use immunoglobulins to help with leaky gut that aren't peptides, but BPC-157 is such a great choice. I use it in my ulcerative colitis patients, Crohn's patients, but even our typical athlete. And when I did my initial peptide course, it was funny because they claimed that BPC-157 was the master's athlete supplement, right? So anybody over 40 that's exercising regularly and can get generalized aches and pains, that the BPC-157 was a great choice for them. And it seems to work very well for a lot of our patients.
I've actually used BPC-157 quite a bit myself because I hear the same things, and I'm an athlete, at least I used to be. I still love to work out, have all these little aches and pains and injuries, and after using it, a lot of them just faded away. I felt really good. Joint pain that I've had for, 3 or 4 years from just college stupidity when I'm trying to lift too heavy and train and be a college shot putter, started going away. So now when I have an injury that's getting a little nagging, I'm okay, where's that BPC at?
Yeah. And it's great for, as needed application. So our, somebody has a wound or post-surgical, you can use it also in those conditions also to improve wound repair. And actually there was a study done on as far as from the musculoskeletal system side, there was a study done on rats where they clipped the Achilles tendons. And this was injectable BPC-157, but they injected BPC-157 into those localized areas, and those rats didn't need surgery. The Achilles tendons just reattached perfectly. And so the uses for oral are definitely better for GI conditions, I would say, but you do definitely get crossover on the joint side. And then you absorb nutrients better, right? So back to your original question about mitochondrial health, I think about, as far as producing energy, producing hormones, we have to have nutrients that come in, but we also have to be able to detox as well and keep good bacteria around it. There seems to be some type of floral benefit as well. I can't quote it in the literature, but it seems like a lot of our patients on BPC-157 really, they don't have heartburn symptoms. Their indigestion goes away. And there's so many of these other symptoms that would probably describe the inability to absorb nutrients or break down certain nutrients. And it seems like there's some overall commensalism that happens in the gut after you do BPC-157. For the actual mitochondrial peptides, I use SS-31, and that one is great because it can really help with boosting just your I call it your iPhone battery, when it goes to yellow and that you're starting to get depleted. And all of my patients just feel that yellow goes to green, and it just feels like you're just, recharged, and you just feel like you wake up at a little bit of a higher battery level that, oftentimes we can also see translated in sleep. So I did a round of SS-31 before I had oral surgery, And I mean, I did combine that with methylene blue, and it was fascinating because it greatly improved my deep and REM sleep and really kind of helped. And probably because I'm sitting in front of a computer all day long, working long hours, and I am depleted. I'm also an athlete, I work out a lot. And so the SS-31 has a lot of use for just your typical person who probably just wears themselves a little bit too thin, but then also for our patients who have severe autoimmune conditions and severe depletion where, I use it in our patients that have Parkinson's and other really debilitating chronic conditions. And it can help at least the meantime while you're working on root cause, helps the meantime day to day, which is great for these patients.
That sounds pretty awesome. I know there's a lot of different peptides that are out there with mitochondria. People are always asking, well, which one?
Yeah. Well, there's not that many available now. I mean, so really, and when you're looking at supplements and such, I'm always really kind of looking at potentially what may be underlying root cause, right? So back to mitochondrial function and something that's not a peptide, I've used a lot of methylene blue. I went to a great conference in June that was given by our North Carolina Integrated Medical Society, but Richard Horowitz spoke, who's a world-renowned expert in Lyme. And so many people have underlying Lyme that maybe somewhat dormant, maybe still causing issues, never had a diagnosis. And a lot of, I think, the biohacking population who's done methylene blue that has had success, I wonder if they have some type of underlying infectious aspect, because methylene blue is an old-timey drug that they used for Lyme way back when, and it does have antimicrobial properties, but it definitely helps with mitochondrial function. So it's been one of my big toolbox, pharmaceuticals actually, but you can also get it from supplement companies also. Some of the supplement companies, it's a little harder for administration because you look like you've been sucking on a blue raspberry lollipop all day. So I prefer the compounded encapsulated forms of methylene blue. But we've had great success with patients with methylene blue. I've had people come off their ADD meds because it does improve brain focus and mitochondrial function.
Well, I actually took methylene blue this morning.
Yeah.
And my mouth did look like a little blue raspberry.
Yep.
But I'll give you a funny experience. So Dr. Jess, a friend of mine, she was telling me about methylene blue several years ago, and she had a company she was sourcing it from, but it was a powder. So you could mix it and dilute it down to whatever you needed to dilute it down to. So there's some benefits to that, and there's some drawbacks. So I'm the guy, it comes to my office. One of my staff was like, hey, can you mix this up? Here's the instructions for body weight. I weigh 190 pounds. They go back to the back, make it, bring it to me. I drink it, my mouth's completely blue. I feel a little nauseous afterward. And I'm like, how much did you make? So I read the instructions. I took 11 times what my body weight should have been on my very first experience ever with methylene blue. And I'll definitely say it's antimicrobial to some degree because I had burning urine for 2 days.
Yes. Yeah.
But afterward, I felt great a couple days later. Of course, urine comes out completely blue. So anybody that's taken it.
That's the biggest complaint is that you can stain your toilets.
Oh, yeah.
Yeah, with it. So, but it's interesting because, I did methylene blue for about 90 days and then now I can't take it because it's overactivating for me. I think I've repleted enough between my SS-31, that, and really kind of focusing on sleep. It does hit a point where not everybody can take it on a daily basis, and then it goes back to as needed for my patients at least. But, and it also depends if they have chronic Lyme, it's going to be a different situation. But back to super high dosing, I mean, Richard Horowitz has you on, he's got this dapsone protocol, which is an antimicrobial protocol for the most resistant Lyme patients. And he has people on 300 twice a day on the last week to prevent methemoglobinemia because dapsone can cause that. So, I mean, I've definitely done multiple dapsone protocols on our patients now, and the symptoms that you're describing, the urinary kind of irritation from high doses can happen, but luckily it's only usually for a week when at the super high dosage. But some of the supplement companies aren't producing high enough dosage that makes a difference in what we're trying to do, root cause wise. Fine for the general biohacker, but I think if you're really treating underlying conditions, you're looking at higher doses.
Yeah, and some people are doing IVs of it, which may or may not be necessary, but I've seen IVs of methylene blue, colloidal silver. We're here at a conference now. CBD, people are herxing off of that.
Saw that. Yeah.
There's some people down there, they're going and getting that, and they know that they have some chronic Lyme going on. They're having big herxes. One person had 102 fever afterward, which just means the body's going through some work there.
Yeah.
So there's always new things coming out. Let's round back into peptides a little bit more, because I know we've talked just about two now.
Yep.
One for healing BPC-157, one for more mitochondria that we just talked about. What other peptides are you excited about?
So I really love ARA-290. That is one that really helps for nerve pain, but any type of like nervous system insult. So I use it in my Parkinson's patients. And obviously, as you know, a lot of Parkinson's patients have a ton of heavy metals. A lot of them have underlying tick-borne illnesses also. But while you're, again, working on these root causes and, they're having difficulty with ambulating, they're having difficulty with activities of daily living, they've got pain, for them, it has really kind of given them this tool to be able to live life better while we're processing, again, the root cause situation. But we also use it for I've got this guy who's like a jujitsu guy that literally he just gets pounded on all the time. He gets some, cervical radiculopathy, gets numbness. We do a round of ARA, it goes away. So it maintains a lifestyle. I don't know that that's the smartest thing, right? But for some of these people, this is their identity, and they want to continue to compete. And they want to continue to be lively and do the things that they want to do. And ARA has been great for that. So we use it a lot for any type of sciatica. It works really well for, I already talked about cervical radiculopathy, ulnar neuropathy, but your traditional patients that have dementia, Parkinson's, all those neurodegenerative diseases, it works very well for too. And actually how I found out about it was my first peptide conference. There was a guy that had basically come out and was I talked to Dr. Seeds during A4M one year, and I was in a scooter and he had some bad reaction, I think, to an antibiotic that left him basically wheelchair bound. He was in his 20s. And he curbsided Dr. Seeds, and Dr. Seeds was you should do ARA-290. And he came into this conference walking and lunging down in the middle of the conference. And he was man, I owe this all to Dr. Seeds, because this was what my body needed, just enough of this push to get my nervous system inflammatory factors just under control so that my body could actually start healing. And he did great. I will never forget that, because I remember seeing him at the conference before. I was God, he's a young guy in a scooter. I wonder what happened to him. But it's pretty remarkable. And I've treated a lot of patients with chronic migraines, chronic pain. I had an unfortunate young lady who had broken her back when she was in her 20s. She's now in her 30s. She was on Cimzia, which is an autoimmune injectable, a Jovi, which is another a migraine injectable. She's on an SSRI, a tricyclic antidepressant. And ARA-290 is what really got her pain under control for us to actually start taking away some of the pharmaceuticals and work on the other things. So it has been an amazing peptide for us in our clinic.
So I'm curious, you've said migraines now, obviously the gentleman with the antibiotic issue that's lunging down the hallway.
Yeah.
But Parkinson's, dementia. So if this is, you said sciatica, and I'm thinking, okay, root cause could be hips out of alignment or muscle spasms in the back, these things. What's happening in the body? You mentioned anti-inflammatory to some degree. What's happening in the body when you're using ARA?
So it's a great question. I think more of it on clinical use aspect. I really think about how some of these patients, entire inflammatory system is in overdrive. It's almost I think ARA for some of these patients whose nervous system is completely overloaded, it's almost that Control-Alt-Delete, right? It's just almost a reset where the system just kind of calms down enough. And then the factors that your body actually are supposed to create to actually help heal actually start working, right? So I think it makes it so that your body can kind of work on healing itself. It's almost I'm an acupuncturist also. So, I used to do a ton of acupuncture. The peptides really has kind of decreased my need to do acu, especially for patients and convenience and flexibility, because they can do their injections or orals at home. But it's almost my analogy is that sometimes the body is trying to help the system, but in turn, it's flooding the system with inflammatory factors, because it's okay, well, hey, you know what? The army needs to come out, but there's no general that's coordinating the effort. So there's just a bunch of fighting forces, but they're all not really talking with each other. They're not doing the right thing to help heal. And then ARA or acupuncture, some of these generals are coming out and they're like, okay, guys, let's kind of calm the inflammation. Let's figure out what we need to do. And then it helps your body kind of modulate, because really, like a lot of our patients that have been on ARA, they don't have to use it all the time. And so like they may do like a course of it. They may take a break, and then the breaks in between may become longer and longer. One of my most successful patients actually has trigeminal neuralgia, and she was on gabapentin. She was on 2 different anti-seizure medicines and getting acupuncture every week for like 20 years. Wow. And she's on 0, not even getting acu now, and it was all from ARA 290. I mean, not all. It was from that and us working on root cause. But it was enough to temporize her pain so she could get off of these drugs that are terrible. I mean, gabapentin, if you've ever taken gabapentin, it makes you so not functional because it makes you so drowsy and you can't think straight. And so, and a lot of, what we do is we're trying to improve performance as well. And you're not improving performance when you're using pharmaceuticals that dull your innate ability to be sharp and for you to actually like formulate thoughts. A lot of our patients that are on gabapentin now are like in shock at how much they can get done, how their thought processes have completely changed, and how successful they are. I mean, we pride ourselves on not just health journey success in our patients, but really like personal success and professional success after they clean everything up and become just more resilient and more efficient.
So I'm so intrigued with this. I know you and I earlier were talking a little bit about neural therapy, so injecting in scars. You just mentioned acupuncture. Is this peptide somewhat working the way that neural therapy, where it's just relaxing the system, even from what may have been stress or trauma to some degree? So it's not necessarily neuropathy or pain, but it's getting a little out of the fight or flight. Is that what you're seeing also?
I do think that there is some crossover. I mean, and I just did my neurotherapy course like during this conference this time, and I've learned a great deal about it that I'm super excited about combining the therapies now, right? So sometimes the peptides may not work as well if the patients are completely clamped down. So if you're looking at these people that are completely in fight or flight, sympathetic overdrive, their body actually can't even receive some of the signals. Potentially there are some that are so extreme that the peptides can't even get past it. They can't even get into the areas they need to be. And that's where, like before I'm not doing neurotherapy yet in clinic. I would love to start soon, but looking at like how I would treat some of these patients with acu. So sometimes that's the case where I will have an acupuncture patient come in and then they become more receptive to the peptide piece because their body now can receive some of that. But it's interesting because in neurotherapy, they're using meridians that are acumeridians. And a lot of what they're doing is so much of what I do in acupuncture, because we have a scar unblocking technique that we do that, I've done it in clinic before. It does work great. I'm so curious to see how it works with the Procaine in addition to it, to see how much more benefit you can get from it. But my goal is always to save the patient money, save the patient time. So if we can quicken that process for them and make it easier for them so that they're also not, finding that they have to come into clinic all the time, that they can actually do the things that they need to do and want to do. That's how I think we should all try to manage our patients,
Completely agree. Simple strategies increase compliance massively.
Yeah.
So many times I get people coming to the clinic that are 30 supplements, 6 therapies they got to do every single day to themselves, whether it's good or they're almost always all good stuff. I'm like, look, there's nothing wrong with anything you're doing. I love all these supplements, all the coffee enemas and castor oil packs and dry brushing and red light therapies and saunas. I'm like, they're all great. Doesn't it wear you out to think about doing all that? No,
I know. It's so there's this whole, I think, classification. Now there's like a new classification as the therapist where they're like, it's almost like the biohackers, like anxiety, like even tracking anxiety, right? Like, are you wearing an Oura ring? Oh my God, I'm waking up. My readiness score sucks. Like, I'm going to have a bad day. Like, you can't let that, create this whole, because a lot of it is mindset, right? As we know. But part of it is, I think you can overdo therapy. And really, like for me, one of the things that I definitely do is I try to, because there's a gazillion supplements that you can do. There's a gazillion peptides that you can do. I mean, I use muscle testing to kind of determine what the best course is for each patient and to try to minimize as much as we can. And then like at our check-in visits, we're cleaning it up. Supplements change, like your needs change, your peptides may change. We may take a little break. Has it been too overwhelming? There's so many different conditions and variables you have to think about for each patient. But I oftentimes get by the time they get off my wait list and they come in, they've seen another functional doc and they're on 30 nutrient, but why are they nutrient depleted? Who has not addressed, you're just getting the supplements to the mainstay piece, back to root cause. Nobody has done the investigation to figure out, why do you have those nutrient depletions? Why do I don't agree. A lot of during even this conference for A4M, listening to some of these innovators talk about utilizing all these drugs that potentially can help with longevity. They have a lot of cost to the system, right? Mm-hmm. And it's just some of this stuff is, I feel like you need to use some common sense. You need to not be on a lot of pharmaceuticals, even if they are quoted as being longevity promoting. You have to look at the individual. This is N of one. Each person is their own individual. That's why I love continuous glucose monitors. I like individual data, but I also love muscle testing for that.
I'm a huge fan of muscle testing. I've been doing it since I got into practice. I don't know how I would operate without the knowledge that I've gained just from doing the muscle testing. Even without actually doing it today, the way that my brain operates in thinking about things has been so molded from the information that's come in, because when you start muscle testing people and you are looking for what their body can actually utilize from supplements, my experience has been most of the time it'll recognize 5 to 7 supplements as useful. And then after that, it starts draining the body of energy. Correct. Because it takes effort from your body to absorb and do whatever it's needing to do that the supplements are bringing in. And that goes for all of the other stuff too. Yep. You can overdo it with anything. I always say to people, anything with a positive therapeutic effect, at some point it could become negative with either too much or too stacked. And it's funny because just sitting here talking to you, we're obviously being filmed. I'm talking to the film crew as he's watched me talk to several people and just trying to figure out what he's thinking. What's he hearing? He's like, it's so overwhelming, all the different things that I'm hearing. It's almost giving me anxiety to think, where do I even start with all of this? And I'm just explaining to him hey, if there's a problem, if you're actually a sick individual and you're not just going to I just want to optimize a little bit. Yeah. If you actually have some conditions going on, what is causing the condition? IBS, your stomach isn't working right? That's the name of it. It's not the cause of it. If you're having mental health issues, what's causing those? Is it inflammation in the brain? Is it a lack of neurotransmitters? Is it a toxin creating some problem? Look for the why, not the name that's been given to it. Yep. So running down that, we talk about... we're in this Western medicine society where it's well, tell me what I have. What's my diagnosis? What's my ICD-10 code? So that insurance can bill, and I don't take insurance. I don't deal with any of that stuff. But it's the mentality of the general public, especially in my landscape, since I'm a MD, I've been able to get a lot of people to cross over onto this more alternative side since I am an MD. But a lot of them have this mentality of I just want to know what my diagnosis is. And it's at the end of the day, it does not matter. And I've proved this back to our patient with the autoimmune condition that was on, those 2 injectables and on 2 antidepressants. Her dad was I need to know what's going on. I was hey, I muscle tested all this stuff out. She's got a tick-borne, she's got parasites, she's got a ton of things that we need to treat. And then next thing you know, he's well, okay. And I was hey, look, pay the $2,400 with Vibrant. Let's do the testing. And it did not change our management. So all the stuff came up on Vibrant. And then to back it up even further, she had cavitation surgery, had a root canal that was infected, and then also 3 cavitation sites. They cleaned it out. And on that path, all of it coincided with the Vibrant, which coincided with the muscle testing. At the end of the day, it changed. Obviously the cavitation surgery was needed, but the Vibrant test that was $2,400, back to saving money for these patients, we bypassed that. Because really, and honestly, the Vibrant test didn't even pick up her parasites. The parasites were actually in the cavitations, but they picked up on our muscle testing. So we were already treating her for that. So it's just, some patients, I think, really want to have something to identify with so that when people ask, why aren't you doing well? Why are you so, why do you always have to call out of work? I think they want to embody a diagnosis so that they have justification as to why
they don't feel well. And we need to move away from that. Like the Western Medicine Society has totally gaslit all of our patients into thinking that, the people that aren't doing well, it's because of them. It's not failure of the system, it's failure of the patient, but you're not looking at the patient and you're not seeing what signs and symptoms these patients have as to what actually is contributing. Does everybody want to live a non-fruitful life? I would say no. But I'll tell you, like fibromyalgia, Lyme even, like all of these like chronic conditions that the Western medicine docs don't know how to treat are the patients that are the ones that have been failed by the system, and they are given SSRIs and PPIs and statins because they're all inflamed, and then they're just, basically left to like live a miserable life with poor quality of health and quality of life on a day-to-day. It is very frustrating to see. And I don't think doctors really want to do, but this is how they're trained in the system. If you don't learn it in medical school, you don't learn it in residency, then it doesn't exist. It's almost like, oh my God, it's like horses with blinders on. And I'm like a conference junkie because I love to learn. And there's so many things that we don't know. And my practice has evolved. I'm, going into my 8th year of my private practice, and I practice medicine so different even from the last 8 years, even though I was alternative to begin with, because I've learned all these modalities and have brought it back to clinic. It's all about progression and learning and just even the curiosity and desire. When you talk to some of these Western medicine docs, it's just like, I don't even want to talk to them because they're like, I know everything that I need to know. It's like bullshit. You don't know everything that you need to know. And they're like, I don't know why you go to so many conferences. I give conferences. And I was like, well, I give conferences too, but I'm always ready to learn. And there's always something that you can build into. But that intellectual curiosity just has faded. And they're just like robots, like literally just give me the protocol. What am I supposed to do? If it's not outlined for them, then they get into this they've begun this whole process of like thinking that there's only one right answer to everything. And it's really just like, and it just blows my mind because you also need to like spend time with these patients and understand what other things back to like mental health and connection and purpose and some things that don't cost any money at all that people really need to think about, that I think we've gotten pulled away from the present with social media and doing a lot of this other stuff that, seems like on the surface, everything looks great. But inside, clearly with the mental health crisis that we have, it's not okay.
COVID showed us a lot of things.
Yeah.
So many things. It showed us that people need community.
Yes.
I can't tell you how many employees, friends, family members were excited to be back in work to some degree. They don't all want to go back to work 5 days a week in the office, but they're like, I miss people.
Yeah.
They figured out that the fear state triggered their nervous system and put them into this mass.
Stop watching the news. It is all about sensationalism. What's the next big topic? How do you get ratings? It's not truly about the thing. And obviously, it's not truly about the things that actually matter and help you, right? If they could just promote healthier eating, and there's no discussion on the preventative side. And we know that 92% of Americans are metabolically dysfunctional. And yet we are pushing big food, all this stuff. And it begins with our children. Our children are coming into the state of just high inflammatory. God, when I grew up, we never really had kids that were overweight, right? And the amount of autism, I think, I gave a talk and I looked at the statistics. It was like when I graduated high school, which was in 1994, it was 1 in 1,000. It is like 1 in 36, which I would argue that is wrong because in every classroom, there's at least 2, if not more. So the 1 to 36 ratio, I think, is actually inaccurate based on what I'm seeing. And it just blows my mind because we don't start with even the education system, like teaching kids. Have you seen a school lunch? It is absolutely abysmal what they're getting. And it begins so much at the home and on values and teaching all of these things. But a lot of these parents have been taught under the traditional system. But then the kids aren't getting the education because I can tell you, when my kid did culinary arts or whatever as an elective in high school, it was a joke. They were feeding them just crap food, all processed stuff. How do you make all these processed foods? Nothing about real whole foods it blows my mind. And just the whole nutrition field, it blows my mind. It's all about caloric intake, which we all know that is incorrect. And that a calorie is a calorie doesn't really matter at the end, and I can show you that is absolutely incorrect with these patients with CGMs that can get an insulin or get a glucose spike from something that's 0 calories, 0 carbs, 0 protein, but it releases insulin and then your body drops its blood sugar and then your liver says, oh crap, I'm not going to get low. And then you get a reactive hyperglycemia at like 140. I mean, from eating nothing, that was non-caloric. Mm-hmm. And that's why so many people are overweight. You're talking about insulin resistance. You're talking about these tenets that we have taught patients. Don't eat fat. Don't eat meat. Don't eat, we're now just poisoning them with these thoughts of and this is actually the result of what the nutrition guidelines were, which had no study merit. It was all based on expert panels. Well, those experts were wrong. Look at our population now.
Well, I can tell you this. I've sat with parents because I work a lot with kids, and you're talking about autism. I speak on this a lot, and it was 1 in 5,000 when I was in elementary school, give or take, and I was there in the early 90s. And then the statistic about 3 years ago was supposedly 1 in 59. Another one came out as 1 in 32. But the prediction is by 2050, it's 1 in 2 or 3.
Yeah. So what are we going to do with this? Right. We have failed. We have failed because we may not be alive to actually take care of these children. So who's going to take care of these children? Hopefully the reform is coming. That's all I have to say.
Yeah, and I've talked to parents too, and I was talking to a couple, and the mother, who absolutely loved her children, was having a discussion with me. I kind of want to call it an argument of pancakes and syrup are a staple of a child's diet because they deserve to have those foods when they were 1. And I go, they don't even know those foods are existing.
Correct.
So they can't.
And I can tell you in China and in Africa, it is not a staple. I mean, it is just unbelievable. But that's what they grew up with. Mm-hmm. But it also could be comfort food, right? They got a little warm and fuzzy insulin release with it, and they associate that with something that they're giving that's love to their kid. Mm-hmm. But it's child abuse. I mean, what we're doing to the children is abusive.
Yeah. I know with my son, who's almost 2 now, I've even had to rework grandma's brain a little bit.
Oh, yeah.
Because for me, I bring out the protein and the fat first,
yep.
and I get as much of that 8 as possible. He is now sometimes up to eating 2.5 eggs at 16, 17 months.
Yeah.
And then he's like, okay, I'm done. And I don't force anymore. He's just like, meh.
But it learns satiety, right? So this whole aspect of protein and fat and fiber from vegetables, if that's part of your diet, that actually helps buffer your blood sugar, mm-hmm. right? But then they actually get full. You start with carbs, you're never full. No. You ride that glucose roller coaster from the beginning. But that's what all these kids are riding. Pop-Tarts, pancakes, bagels. I mean, think about what the traditional breakfast is. And it's so funny because, when I have 2 daughters, one's 18 now, and I have another 15-year-old. But when the kids would come over for spending the night, they're like, we don't want to go to Kylie's house because they don't have cereal. They don't have breakfast food. Because we just eat, my daughter eats stir fry for breakfast. She just eats regular food. Whatever the leftovers are, mm-hmm. that's breakfast. And it's just funny because this whole concept of well, they don't have donuts. They don't have muffins, and they don't have anything good in their house. And it's just
and all of the good things and the bad things.
Yes.
I say just with my son, he eats the protein and the fat. He's done. And then we go and we grab applesauce or banana or something else, and he'll eat some of that, and then he's full and he's done.
Yep.
Sometimes he gets full. He's a little tank. But it's so funny because if she gets the carbs out first, he won't even touch the protein and the fat.
Because it turns on these little sensory signals, and you want more and you want more and you want more. And it does not promote for healthy eating. I mean, that's really you've done it right. You have to start with the stuff that's actually going to send the right signals and actually make it so that they can choose what actually is more important. Because once they get the chemical stuff, all those refined carbs and the goldfish and the puffs and all this stuff that I see that these kids eat, and it's it's not food. This is why these kids are so nutrient depleted. I mean, I can't tell you how many kids, honestly, some of our kids are sicker than the adults. Like some of these 20-year-olds are sicker because they've never had a basis of a good diet. So back to like gut microbiome and GI system. I mean, these kids never knew what it was like to actually have the right things to fuel their body to begin with.
It's always fun to talk about the hot topics, the peptides, the injections, the IVs, all the technology. But for everyone I talk to that's an expert in those things, when they really understand health and root cause, they're always like, well, what are you eating? How are you sleeping?
Yes.
How are you pooping?
Yep.
These basic fundamentals. What boundaries are you putting up in your life to make sure that you live a healthy life around people and too much work and these things? It's those basics that are still important. And it's fun to just have this talk because I bring you in to talk about peptides.
Yeah.
And here we are talking about fundamental requirements of health. Otherwise, the peptides don't do all that they could.
Correct. Well, and you can only, it can cut some inflammation, but if you're going to continue to do those inflammatory processes, you're going to be on peptides for the rest of your life, which is fine. I mean, if that's what you want to do. But I like to see people get better and not have to use as much of things, right? So again, it comes back to like the least amount that you can do, the better, if your body can process and do those things. But you got to give it to the right tools. I mean, your body is an amazing machine. I always think about that, right? Giving birth twice, like the fact that you can make a baby and push it out and that like everything, for the most part, it's a phenomenal. And it's just like, we think that the body, in what a lot of people who rely on Western medicines, they've not trusted their body anymore. They think their body has failed them. But we can fix it at any level, at any stage. We can get improvement.
Well, I think that's a great place for us to come to an end. How can people find you if they're looking for a MD that is so well-rounded with all the fun tools, but also the good basis?
Yep, my Instagram's at Dr. Hansell, DrHansell.
Thank you so much for today.
Yeah, thank you.
Thank you for tuning in to Redefining Wellness with Dr. Jaban. If this episode spoke to you, please follow and share this podcast with someone who is ready to take control of their chronic health symptoms. Also, please consider leaving a review. It helps more people find the show. See you here again.